Mental health and stigma are a big problem in today's society. People with mental health disabilities often find themselves facing stigma and prejudice for no reason other than the fact that they have a mental disability, no matter how significantly it does or does not actually impact their lives. They will be denied jobs or forced to accept jobs that are beneath them, and sometimes even with pay below minimum wage. In some cases, they may not even be treated as human beings when it comes to accessing things like healthcare or housing that those without mental disability have no problems with. This is a violation of their human rights. It doesn't help that the media will often only show them as violent, uncommunicative, or just different. The negative ways they are shown only serve to create or enforce more stereotyping. Oddly enough, they find themselves facing the most prejudice in the one place they might expect to get help. In the medical profession, there is a striking lack of training in regard to mental health, so when patients go to a general practitioner or a hospital, there is often no one who can actually help them. Doctors also have a strong motivation to see as many patients through in a day as possible, so even those with the training will rarely take the time to actually help their patient. One of the biggest problems today is referred to as diagnostic overshadowing, which refers to patients with mental health problems having their physical problems dismissed by doctors as manifestations of their mental illness. This is frustrating for patients and staff because the mental wards the patients are sent to don't have the resources or means to take care of their physical problems, like a broken leg or something more tangible than their mental health problems. Not getting the required help causes stress, which only aggravates the condition more and makes things worse for everyone overall. Thankfully, there are 7 key steps written up by the Mental Health Commission of Canada, also known as MHCC, on how to reduce stigma and discrimination against those with mental health problems. Step 1 is to know the facts. Learn as much as you possibly can about mental health, such as what brings it on, how to prevent it, the severity of cases, and most importantly, the difference between fact and myth. Second, be aware of your attitudes and behaviors. Most of us have been raised in the same society that raises our more prejudiced individuals, so it's important to make sure we're not reflecting those same behaviors. We have to look beyond the stereotypes and see people as human beings. Step 3. Choose your words carefully. Sticks and stones are not the only thing that can hurt us. It is important to use sensitive words. Rather than saying schizophrenic, you can say person with schizophrenia. Step 4 is to educate others. Whether it's a big campaign or just telling someone you know who makes a discriminatory remark that they're being rude, it's important to spread the message and help others know the facts. Step 5 is to support people. Trust those with mental health problems to know what they want and treat them like you would everyone else and encourage their efforts and actions towards change. Step 6. Include everyone. More than just employment, this can be applied on a broader scale by fighting for the human rights of those denied housing and proper health care. Step 7 is to focus on the positive. Rather than always focusing on the negative media portrayals of those with mental health problems, look at the positive contributions that they make to our society. Thank you for listening.